Hi, Miss Annie. It's so good to see you. How are you doing?
It's nice to see you, Dr. Gupta. I'm absolutely fine. Absolutely fine. Everything's good.
How many weeks that we have had your procedure? You had your redo facelift with us, face and neck lift.
Yep, I had it done on was it the 30th of October?
Okay.
So,
2.5 months.
yeah,
Okay.
yeah.
So you look amazing. Um, just wanted to talk to you and discuss about your journey. So, we did a redo surgery. What's your age and when was your first facelift done?
Right, I'm 61,
Wow.
62 in May.
Okay.
Um, yeah, as you know, I did have a first facelift. I had one when I was 40.
Mm-hmm.
That was a mini facelift. That was
Mm-hmm.
good. That was good. I then had one when I was 50. There were
Okay, so
very
you
little
had one at the
changes.
40 and then at the 50. So
Yeah,
the
10 years
second one was at
later.
50. So I did the third facelift for you.
You're on the third facelift.
Oh,
Yeah,
wow.
the second one wasn't as good as the first one.
Hmm.
And there was very little change initially.
Hmm.
Um, and I did have quite, as you saw, I did have quite a bad scar here
Yeah,
as
yeah, I
well.
remember the scars were pretty wide. Yeah.
Yeah,
They just
yeah.
stretched out. The scars stretched out. So,
Yeah, and when I got to 60, I looked I looked very much 60. Um my face had sort of fallen down here, and I got baggy eyes.
what do you think that you look like now?
What I look like now is when I look in the mirror now, I see not a stretched version, but it's natural, and I look more like I did when I was in my 40s.
Hmm. So good. So good to hear that. Yeah. So you had sagging of your cheeks and your jowls and your neck was sagging.
Yeah, it
Yeah.
was coming down here.
Yeah.
All this was
Yeah.
sunken. Well, you've got the pictures, haven't you?
Yeah. Yeah. I have
Um,
got the pre-op pictures. Yeah.
mm.
So, just take us through how did you decide to come to India? I'm sure it must have been a daunting task, and especially when you traveled all alone to India.
Yeah, and I had to make the choice on my own, and I've never been to India. So
Yeah.
I had to find a cosmetic surgeon. Obviously, you know the prices here are absolutely to get a good facelift.
Hmm.
It's three, four times is probably a lot more than you charge anyway. So they do them in Turkey, they do them all over. I didn't want to go to Turkey. Um, I knew India. Um, I knew we have a lot of Indian doctors here, basically, who are very
Yeah.
good. My
Yeah.
doctors are
Yeah.
Indian.
NHS
Um,
has a lot of Indian doctors.
mm, pardon?
Your national health scheme, the NHS in UK has a lot of Indian doctors.
Oh yeah, my own doctors are Indian.
Oh, lovely.
And yeah, they're lovely. So, and um, I've done a lot of yoga in the past. So I knew I wanted to find a cosmetic surgeon in India.
Hmm.
Um, to get a good job, and then so all I could do was search like New Delhi, all the top cosmetic surgeons, and
Hmm.
believe you me, it took me absolutely ages.
Hmm.
And you find who the best ones are. No names. I found another doctor before who I'm sure was perfectly all right,
Hmm.
but then I, I wanted pictures. I wanted to see as well the before and afters.
Hmm.
um, and there weren't any pictures. And then your name just kept cropping up. Um, you can go to the hospitals like the Max Hospital, and it'll tell you where to find a good hospital and where the good cosmetic surgeons are. And you weren't in the Max Hospital,
Hmm.
but your name kept cropping up.
Hmm.
You were, and then I found you on YouTube. I found that the way that I could approach you, your
Hmm.
price list there was open. Um, and I read some amazing reviews. So I thought I'd contact you. We got in touch, and I just knew, I just had a gut feeling that right now you've found your surgeon. I spoke to you, you've got all that, which is really good. You're on YouTube and you talk openly and everything. So I just thought, right, this is the man that I want. And so I rang you, I spoke to you, we arranged it.
Hmm. I
Um,
remember we had an online consultation before you traveled.
yeah, we did. And
Yeah.
you look at your own face and you think, well, I need that bit doing there because that's look at that there and look
Hmm.
at that there.
Hmm.
And then you think, then you start doing all this, don't you? And then you start thinking, well, how are they going to do it? But
Hmm.
you knew, and I'd researched. There's fat fillers, there's this, there's that, and I thought, well, I'm going to need more than a mini facelift, but I need something else as well. And you just said, yeah, I can see you need that, you need that, you need that. So you've done 1,000. I don't know how many you've done, but I thought, well, yeah,
Can't say
it's
I've
just
done
said
thousands
everything
of
that I'm
facelift, but
thinking.
I've done more than reasonable number of facelifts too. Yeah, of course.
To know what you're talking about more than what I know I'm talking about. So you have to just say, right, I've got my surgeon. That is the main thing. You find your surgeon, you find him, and then you take it from there. So and I did that, and I didn't worry after that. I didn't think, and I didn't tell anybody what I was doing. But it is a worry because you think, well, crikey, I'm going to come back with a different face. Someone's going to be cutting into my face, and what am
Yeah.
I going to look like afterwards? So,
No,
but no, I didn't worry. You just have to close your eyes and say, well, this is what I'm going to do. So I'm going to do it. So I booked my flight. So I didn't bottle out because I've never been out. I've never been farther than Spain from here, which is just across the water.
yeah, yeah.
So
UK, Gibraltar, and Spain. Of course, it's just across the border.
yeah, it's just across the road. Yeah, India's the other side of the world. So no, but everything went fine. I did struggle, as you know, in New Delhi because it was far busier.
Of course, it's
But you helped
huge,
me there as well,
hugely
so it was
populous
good.
country.
Yeah.
So, no, it's amazing that you have the trust on us that you decided to come to us. We had an online consult. So, when people come to India, especially alone, India and the crowd, and overall the amount of hustle and bustle in the city, especially in a city like Delhi, can be pretty intimidating. How did you
Yeah.
take that?
I struggled. I struggled from the minute that I arrived. I looked out the door and it was mad, and I thought, when I got to Delhi, I thought, oh my goodness, oh my goodness.
Yeah,
Um, yeah, anybody coming to India, you have to. I mean, you're not allowed to take rupees into the country. You're allowed £1,000, but I'd never been. But so then I had to use the cash points, and it was just mad. All the traffic. It's it's just it's just so busy. But then I found you,
we are the most populous
and I
country in the
found
world, so
Rene,
of
and
course
then
it's
she just
busy.
told me what to do. She arranged for me to get there.
So I was about
Um,
to get that. So I'm sure my team must have helped you in managing things, though.
yeah, yeah. Without Rena, I mean, I could text her. Well, I did. You get a shock when you first see your face because it's obviously being tampered and everything. So I'm texting Rena, and she said, "Don't worry." And then, of course, even when she said, "Oh, that's nothing to worry about," you took the time to say, "Well, that, everything's all right." You even got me to come in just to make sure that I wasn't. You did check, even though you knew everything was all right. So I just
See,
got that
we
reassurance as
understand.
well.
Understand, surgery is an emotional journey, and sometimes during the recovery period, patient can see some things which they don't expect, although we explain them
Yeah,
everything. And especially when you're traveling alone, you have no one, you tend
yeah,
to panic and you tend to, have thoughts, some negative thoughts. So it's
yeah.
always good idea, and it's our practice. We ask our patients to come back in so that I can have a look at them, genuinely see whether everything is fine or not, they're recovering well, and then just calm them down if everything is fine. So that's been our practice always. So yeah, so here we are after around 10 weeks of surgery, talking to you. Can you show your scars?
Well, I did have scars, but I had more scar when I came to you than I do have now. I couldn't I couldn't find my scars. I'm thinking, what's he done?
Hmm.
Um, I don't know how you put fat in the face, but I can't. I don't want to know where you got it from because I don't know where you got it from. There's
Yeah.
nothing.
Just a needle prick in
But
the tummy and we take out the fat.
yeah,
No, but just pull your hair
and
back. Pull your hair back.
I
Let me.
need my hair color in here, so I'm so sorry about this.
Okay.
But all I've got here, right?
Just
I don't know
around the
if you can see.
lobule, I can see some. Yeah.
Yeah, there's no
That's
scar as such. It's just a little lump underneath. That's all
okay.
it is. It's
And the
I
other
can just
side?
feel a little
And the
knotty
other
lump.
and the other side?
And the other one, barely a knotty lump. There's
Oh, good.
nothing there. So
Good.
somebody looking behind my ears,
Hmm.
and I've told
Okay.
my friend, and she said, "Well, nobody's going to look," because I said I've got to wear my hair up for work like this.
Yeah.
So are they going to
So
see? And she says, well, "There's nothing there, Anne. There's nothing there,
tell me
And
something. What does this surgery mean to you? Why took
to
all the
me,
patients to come to a different country, get your surgery done? What does it mean to you?
it's a lift in yourself. I know all women. You start looking in the mirror and you start thinking, "Oh, I can't go out looking like this," and oh my God, do you know what I mean? And
Mm-hmm.
you just feel tired. I mean, obviously, when you go out, you put your makeup on, you feel better.
Yeah.
Anybody does from a
Yeah.
woman's point of view.
Yeah.
So
Yeah.
to go out the door when all your face and all your little, you can buy as much cream as you want, and they
Yeah. Yeah.
claim to do all these things, but it doesn't work. So I just think you have to if you want to look better and you want to get rid of that job, it just makes you feel better. And people, just say have told me how well I look.
Mhm.
Somebody said, "What have you been eating in India?" They don't know that do you know what I
What
mean?
were you eating
They
in
just
India? Yeah.
what you eating? Give me
Yeah.
some because
Yeah.
I just look well.
Hmm.
But there have been dramatic changes. What I don't
Yeah, of
understand is
course.
that I've had it. The impact when I had this done as opposed to the other two.
Mm.
The change in my face was amazing because there was more done,
Mm.
probably. Are you with me? Like
Yeah,
a
yeah.
panic because it was all swollen here, wasn't it? And I thought,
Yeah.
oh my God. But that all goes down. So, the bigger the maybe change at the beginning,
Hmm.
you've done more to it. You haven't just given me a little facelift here. You put fat in, so all that needs to settle down. Plus, you put your face is really swollen because of the fat, and you think, oh my God, is this? But it doesn't stay like that, does it? It needs time to settle down.
Yeah. See, you also had a tertiary facelift. So whenever you do a surgery, which is redo surgeries, the swelling and the bruising is much, much more than the primary surgery. So that's another reason why you had a lot of swelling. But okay, now I understand that this surgery is not just has a physical result, which we can see, it also has a mental uplifting effect on that person.
Yeah. For
Uh,
every day, every single day of your life, you feel better
hmm.
because you feel better. Do you know what I mean? Because you,
Yeah,
cause you look a lot better than you look.
yeah,
It's deception in a way, but it's nice. You look after your skin, you look after your face. You
yeah,
you feel better in yourself. It's
yeah.
mentally it
Hmm.
it has, I think, a more powerful impact
Hmm. No, I
than
totally
anything.
agree. And that's what all of our patients actually tell us as well. Now, a lot of people think that this is just vanity. What do you have to think about this?
Yeah, well, that's why I didn't tell anybody because they'd all say, uh, and your friends say, "Oh, more to worry about." More and more people are having this done, and of course, there's a lot of poorly people in the hospital, and you know, so you feel guilty because you feel vain. But
Hmm.
there again, you've got to find yourself acceptable.
Hmm.
You don't want to go be having a nice day, then you go to work and you look in the mirror and you think, "Oh my God," do you know what I mean? It's
Yeah, yeah,
that that
I
takes
understand. I
that
know, I
takes
get you.
over people. Yeah.
Hmm.
So yeah, I did feel vain actually, especially even when I got to my hotel up in Rishikesh. That I'd obviously had some work done, and I didn't want anybody to know,
Hmm.
because I would have felt vain. So
Mm.
which is kind of in a way why you keep it to yourself. Maybe not in America so much.
Just a
I
sec.
don't
Just a sec.
know, but
Hello. Huh. मैं फोन करूँ तो 5-10 मिनट देते। Sorry.
no.
Yeah.
So yeah, you do feel at the back of your mind, you think, am I being vain to put myself through all this? But it's not. It's all about you, how you feel about yourself, isn't
Yeah.
it?
I agree, and almost all our patients have this thought. Now, any people there are a lot of people in this world who contemplate cosmetic surgery but are very apprehensive about it.
Mm.
What is your message to them? What is your message to you to people who think like that?
Yeah, they think, oh, I'm not brave enough to have it done. I've seen what they do on telly and everything. It's it's the thought is a lot worse than doing it. You go to sleep. You've got a good surgeon there. Do you know what I mean? You've got a
Yeah.
surgeon who's doing the work. You're not doing the work in your head. They're doing it for you, and they've done it many times, and the
Yeah.
results are good. So you've got to think about that and just go and do it. Like I say, as long as you've got a good surgeon who knows what he's doing, then you shouldn't need to worry because there's no pain in it. You
Hmm.
can even the next day, you're up and you can do anything you want to do. It wasn't even painful.
So what do you
It's more
say
painful having a
if you
tooth taken out.
if you have a good surgeon, then just trust the process.
Yeah, that's all you have to do.
Hmm.
Yeah. And when you start thinking about it, thinking, well, why am I thinking about it? If you go into hospital and have any of this done, you don't start thinking about how he's going to do the operation. You've got to just think he knows what he's doing, otherwise he wouldn't be doing it. I know that's not the case for a lot of people, and there have been mistakes,
Hmm.
which is why you need to get somebody who's had the training, know what they're doing. Do you
Hmm.
know what I mean?
Yeah.
Listen to the feedback, listen to the reviews. So then why not have something done that you want doing all your life when all you have to do in truth is come, you get the anesthetic, you go to sleep, you wake up, and the next day you can just carry on doing what you're going to do. You're just going to feel a little bit uncomfortable for a
Yeah.
few weeks, which is hiding away, and coming to another country is also good. Then you don't have people knocking on your door because you're not going to look good for 2 weeks, but
Yes.
you can still carry on doing what you're doing, you
Yes.
know.
Absolutely. So
So
yeah, social downtime is there, but you're physically fine from actually the next day.
mm, and
So
it's not actually anybody can have it done. You do. It used to be a stage where you used to have a loads of money in the bank, and only the rich people could have it done. So it's affordable. You just need to get on a plane. That's all you need to do. Get on a plane and get it done. You know.
yeah.
So I just say to all those ladies out there, thinking, well, I want it, but oh my God, it's a long way. And what if, what if, what if? It's not half as hard as you think. She can just come. A taxi will bring you straight from the airport to you.
Yeah.
Rena will pick you up. She'll even book you a hotel. She'll
Yeah.
arrange for a taxi, and then just have a night. Take a book, read for it. Just sit out. It's easy.
Yeah.
So just do it because why deny yourself of it? I've got this now
Yeah.
for I don't know how long it will last, but my cheeks are up. I
No,
don't even have to
it
wear
will last. It
makeup
will
at
last.
work.
It will last 7 years,
Yes,
10 years, it will last. Okay. Now, do you what do you think that you miss about India the most?
India. Do you know what I miss? I come back and everybody's saying, "Oh, how was it? How was it?" The people. It was to me. It was an amazing experience. It was
Mhm.
like, oh my God. What I like about India, you've got a lot of people there. You have to deal with it. We don't have people on the streets and all that. Yeah.
Mhm. Mhm.
But, and at first I was scared, but I think, well, maybe that's how I think in Britain, because if
Mhm.
there were people on the streets here, there'd probably be a lot of rioting and drinking, and everybody shares. They
Yeah.
would, they would.
Yeah.
You've got a house and we don't, and all that.
Yeah.
Everybody,
It may seem like that it's mad and chaos out there. Um,
it,
but here it
it's
is all
mad, but
but
you all have to
there is
share
some
the
sense to madness. and there is some sense to chaos, and that's why the work gets done. Everybody reaches where they want to reach, and so there are some rules and sense to it.
But it was lovely because everybody respects who they are and what they're doing. You're all sharing the same space, which includes cows. You've got cows everywhere, even on the motorway. So it's like, oh my God, I can't believe I've seen a cow because all hours they're in
Hmm.
fields.
Hmm.
But everybody was nice to me. Everybody helped me. Even when I got to Rishikesh, the owner in the hotel, they knew I was clearly on my own, clearly didn't know what I was doing.
Hmm.
But everybody helped me and it was nice. And I got home and I'm thinking, what in the pub, what's that dog doing on a lead? You know, and why are they, I used to sit in Rishikesh and people used to come up when they saw me around and say, where are you from? Can I talk to you? And it was nice because I had the company there as well. Whereas here, I'm thinking, why don't you come over and talk to us? So the people were lovely, but I struggled in Delhi because of it is quite the air's quite, do you know what I mean? The
Oh,
what
you
I was
came in
used to a
that
cup of
month. You
tea.
came in
You
that month,
don't
which
you don't
was, yeah.
Yeah, and you don't make tea like we make tea. And I like a good cup of tea.
There's a difference between English tea and Indian tea, but but it's the warmth in the tea which is more important, I believe. We would love to host you again in India whenever, if at all you come to India in future. Do meet
Do
us.
you know, Dr. Gupta, if I'm 70, I mean, I'm 61 now. If I'm 70 or 80, you don't just do facelifts, do you? If there's anything I'm not happy with, I'll be on a plane and I'll be back. But I just hope you're there because,
I hope so.
it's good really because any other little issue that I've got, I can think, well, just get on the plane, yeah. It's a long way, but you've got a video, you can sleep, you can whatever, and you're going to be there, and then I don't have to worry about finding something else. Whilst I was in the waiting room, I noticed I was talking to a lady from, was she from East Africa?
Maybe.
They were coming from all over, and you were doing all sorts of things.
Hmm.
She was.
Yeah, we get
It's not just.
patients. Yeah, we get patients from all across the globe. So whenever you want anything, or even if you're touring to India, we will love to have you and meet you again.
Yeah, and I might just decide to have something to do so I can see you again because it was it was lovely. And this is our last chat, isn't it? Because it's so long after the surgery. But I hope to see you again
Yes,
and
hope to
don't
see
go
you again.
anywhere.
And you will have another follow-up after 2 months from now. So send your
Yeah,
pictures after 2 months. Rina will schedule another consult, another follow-up consult, and we will
yeah,
chat again. We're always there. And
yeah,
lovely talking to you as always.
yeah. Okay, and you take care.
Ciao, bye
All
bye.
right.
Bye.
See you, Dr. Gupta.
See
Bye
you.
bye.
Bye.
Bye.